with soap. And that is the best way to get rid of bacteria, because bacteria is what spreads to spread disease.
Now, you made mention of with soap, with running
Yes.
water. Now, I know many of us have run into situations, particularly here in Africa, in Nigeria,
Of course.
where you have the water, but you don't
no
have the soap.
Yes.
What do we do in those situations? Can we still at least do something?
I think still water will still help.
Okay.
But of course, it's not as effective. Soap is an antibacterial, and there's a lot of antibacterial soaps, and soap helps to kill the bacteria that you pick up and touch in. Every little surface you touch may have bacteria, so it helps.
Now, last year, as you made mention of earlier, this whole issue of sanitizers was big, and there is some research that sanitizers sometimes can actually contribute, because there have been people who are saying that because the world might be overusing sanitizers, it's sort of like your body overusing antibiotics. The bacteria are becoming immune, they're becoming stronger. In terms of sanitizers, do they really do what they say? Many of them say 99.9% effective against all germs and bacteria, whatnot. Do they really do what they say they do?
They do, for the most part. You know, that 99.99% is to cover the 0.0001% for the bacterial company and for the antibacterial companies. But they do. It's proven that they're very effective in killing bacteria. So that's why last year it was off the shelves. People had bought them out. There was a lack of supply in Nigeria because it works.
Is there a right way to use hand sanitizer?
It's much like washing your hands. It's to make sure you spread them over the whole of your palms and every finger through your nails, and because every surface you could touch, as you can imagine, you're touching it with your nails, with your the tip of your fingers, your palms, so you can pick up bacteria anywhere.
All right. So wash your hands when you do what? Because you'd be surprised at how many people don't know when they should be washing their hands, or when they assume that, you know what, I cannot wash my hands this time because it doesn't really matter.
Yes. It's best practice is to wash your hands after using the toilet, and also after touching any possibly contaminated surface or surface that may have bacteria on it. Doctors especially, are the people to wash their hands most, because that's where diseases can spread most in a hospital. So those are the areas to wash your hands most.
All right, so the hashtag on social media, particularly on Twitter, is It Starts With Me. It Starts With Me. Bankole Cardoso is from the Dr. Ameyo Adadevoh Health Trust. He's a member of the Board of Trustees. We're celebrating Global Hand Washing Day, getting the word out that washing your hands and spreading the public health message that by simply washing your hands, scrubbing, using an antibacterial soap for 20 minutes with running water, drying your hands, can work to prevent the spread of diseases. Now, if people want to get in on this, learn more, where can they do that?
You can visit our website at www.DRASA that's DRASATRUST.org.
Now, do we have anything happening today that people can be part of? Is there any meeting, any meetup, or anything like that?
Today is a social media public health awareness campaign. So people are posting pictures of themselves with their wet hands or soapy hands, and putting it on their Instagram pages, their Twitter, Facebook, all their social media.
I'm going to be a typical Nigerian. What do I get?
You can get a t-shirt.
Doing this.
So
I already have a t-shirt.
Here in Nigeria Info, you have many t-shirts that you can give to any callers in or people that tweet at you on social media. So we have a t-shirt with the message.
All right, so the message is very clear. It starts with me. It starts with you. Wash your hands. If you are not exactly sure what we mean, go to facebook.com/Nigeria Info FM. You will find an infographic up there. You'll find some information on how the right way to wash your hands, when you should wash your hands, the use of course, hand sanitizers, and the right way to use the hand sanitizer. Information, as we say here on the station, is a source of development. And if you want to stay safe, you want to stay, what's the opposite word of not sick? What's the opposite word of sick? Not sick. Okay. Healthy. If you want to stay not sick, this is what healthy. Thank you. I was looking for the opposite. If you want to stay healthy, this is what you need to do.